everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS, and let's move on to the next lecture of the success course to UKMLA 2. Before I begin this particular section, what I would like to give an overview of is how basically the exam begins and how a particular station starts. You're there in the corridor in the GMC building in the Hardman Square or Street, and before you actually begin those 8 minutes, before you actually begin your 8 minute consultation, you get 1.5 minutes to read a task. Okay, and a task like the one that is shown on the screen would be there pasted on the door of the cubicle of that particular station. Okay, you would hear a bell saying that begin reading your task. Okay, that means that those 1.5 minutes have started, and the next 90 seconds are to be used to read the task and understand what is required of you in a particular station. Okay, and trust me on this, those 90 seconds are like really important. Okay, they are even like more important than those 8 minutes that you're going to spend inside the cubicle, because the way you understand, the way you read, and the way you interpret those the task that is mentioned in those 90 seconds, that would determine how well your consultation would be, and that would very strongly make sure that how you are performing in a particular station. Okay, so those 90 seconds are the golden 90 seconds. Okay, and I'll tell you what to do in those 90 seconds and what are the things that you need to identify. Not just read, not just skim it with your brain shut down, but you need to read something and understand that what it means and why that particular thing is mentioned in the task. Okay, and based on your understanding of those tasks and your understanding of what is required of you, it would depend on the kind of structure and the kind of approach that you would take for a particular type of station. Okay, so it's very important to identify a few parameters. Okay, so I'll just quickly discuss and move on to the parameters that you need to assess. Okay, and the parameters that you need to see in those 90 seconds. Okay, the first and the foremost thing, before even you identify what type of station it is, you need to see your setting. Okay, where you are currently situated right now. Okay, you may be in the GP surgery, you may be in a particular department. Okay, or you may be in the A&E or the ED, that is the emergency department. Okay, so you can be placed anywhere. Okay, and this is like very important, and primarily because the type of consultation that you do would really depend on your setting. And like what most people and most candidates, what they miss is that they don't understand that where they are sitting right now. So let's suppose that this is the case, like shown in example number 2, that you are in FI2 in the pediatric department, and then you start taking the history, you start doing the consultation, and at the end of the consultation you end up saying that okay, I would like to refer you to a pediatrician. Okay, that wouldn't make sense because the patient is there in the pediatric department. Okay, the patient is not there in the GP surgery, or the patient is not in the A&E, that you would have to refer the patient to the pediatric department. The patient is already there in the pediatric department. Okay, and just because we don't read it properly, we do not understand where we currently situated at, we end up making this mistake, and that results in us losing the marks in the management, and it's a very common reason to lose the marks. So always identify where you are, because the referrals are done from the GP surgery or from the A&E. Okay, and similarly the admissions. Okay, let's suppose that a critical case comes to you in the GP surgery, or a patient with chest pain may be suspected MI, may show up to you in the GP clinic, and over there you're doing the consultation, and over there you ask about the history, and then you did the relevant examination, and then you are like, okay, I would like to admit you to run some ECGs, to run an echocardiogram, to send your bloods, and then the patient would be like, doctor, how are you going to admit me in GP surgery? Because the patients cannot get admitted in GP surgery. Okay, so if you are sitting in an A&E, then you can say that, okay, I'm going to admit you. All right. So it's always very important to identify the setting and where you are currently situated at, because that will really depend on how you manage the patient. Okay, so that is one very important aspect of reading the task. Okay, other than that, the thing that I've been focusing on for a while now in the previous lecture as well, that you need to be able to identify what type of station it is. Okay, and one by one I'll go through how you can identify a particular type of station. Okay, so let's just begin with identifying the history based stations. Okay, uh, just to overview that the history based stations are the ones in which you have to ask certain questions, come to a diagnosis, and then manage the patient. Okay, and this is not the combined sessions. You do not have to actually perform the examination. Okay, you just have to verbalize it, that okay, I would ideally I would like to do your general physical examination, your abdominal examination, your digital rectal examination. You just have to verbalize it in the history based station. Okay, you don't actually have to perform it. Okay, and uh, it can be from any category, to be very honest. It can be from the medical diagnostic category, it can be from the pediatric category, as seen in example number 2. It can be an emergency case, it can be a surgical case, it can also be a gynecological case as well. Okay, dermatology, and like it can be anything. Okay, from any category, psychiatric category as well, patient presenting with sleeping problems, with tiredness because of depression. So it can like go in any direction. Okay, so you need to be able to be identified that okay, this is a history based session, and in this I have to make sure that my history is much more detailed, and I'll talk about how to divide your time in different type of session later on. But just to keep in your mind that your history needs to be like really detailed in these type of stations. Okay, and how do you identify it? Okay, the way you identify it is basically by checking if there is a symptom that is mentioned in the task. Okay, most likely there would be a symptom that would be there in the task that will help you understand that okay, this is a history based station. Okay, just a symptom would be there, nothing else. Okay, and I'll just very quickly go through the examples. Like for example, in this case, you can see that tiredness is a symptom that is mentioned. Okay, then in the next case, you can see that jaundice is a symptom that is mentioned. Okay, so automatically it should get into your head that you need to explore jaundice, you need to explore tiredness. Okay, then there is a back pain, another symptom that is mentioned. Okay, then in the next station you can see the symptom of weight gain is mentioned. Okay, so automatically the differentials of tiredness, weight gain, back pain, or whatever the symptoms that is mentioned in the task, like this, those differentials should come to your mind. Okay, and you should be mentally prepared for the fact that yes, this is going to be a history based session, and I need to take a detailed history, I need to ask detailed questions, and I need to follow the structure of the history based session, and not take a very counseling oriented approach. Or yes, the ethical consideration is always there, but my main focus should not be thinking about the ethical scenarios, and my main focus should not be the ethical consideration. My main focus should be the medical consultation first. Okay, and this is like very important, and most of the cases are going to be history based stations. Okay, like more than 50% of the cases would be history based stations, and as I mentioned earlier, it can come from any category. Okay, so that is very simple to identify. Okay, there is no rocket science in this. All right, then comes the combined stations. Okay, and it's very important to identify, and there is a trick in identifying the combined stations, because it can be difficult to identify if a station is combined or if it's just a simple history based station. Okay, so sometimes GMC is very generous, and sometimes they want to make things easy for you, and sometimes they end up already written, write it down in the task that you need to perform a relevant examination. Okay, sometimes they do that. Okay, but this is very rare. Okay, and GMC is not always very generous and not very kind to give you the hints that okay, yes, this is going to be a combined session and you should perform relevant examination. Okay, most of the time what they do is that they try to play some tricks and they try to play some mind games with you. Okay, and what are those mind games? Because they want to make the exam difficult, they want to make sure that the competitiveness is there in the exam. They often end up hiding the mannequins. Okay, so when you enter inside the cubicle, okay, but even before that, when you read the task, you would not realize that if it's a history based station or if it's a just a combined station or it's a counseling based station, you wouldn't have that idea. But when you go inside, okay, there is a very strong possibility that you may see a mannequin. Okay, you may see a mannequin just like placed next to the examiner on the table. Okay, that should ring a bell that okay, there is a mannequin placed over here. Okay, you may have to perform some examinations. All right, but often it happens that they hide the mannequin, as I said. Okay, and it's very late until when you realize that okay, this is supposed to be a combined session. I'll give you an example. I remember it was my exam, and when I entered inside the cubicle, I had a habit of just scanning and trying to get aware of my environment and what's there inside, and I did not see any mannequin because it was not placed in my vision. Okay, what they did is that they placed it behind the door. Okay, and then when I opened the door and then I looked around, I did not see a mannequin because the mannequin was placed at my back. And then I was like, okay, this is just a history based session, and I'm going to, take a detailed history. I'm going to get into the depth of it, and I'm going to make sure that my questions are, asked in a lot of details. And then at the very end, just before I begin my management, I verbalized that okay, I would ideally want to do a digital rectal examination. And then as soon as I said that, the examiner stood up. He just went to my back, uh, opened the door, and then he showed me that okay, here is a mannequin. Go and perform the examination. And then I was in a state of panic, and I was like, okay, now what should I do? I do not have that much time to do the examination, and like the 2 minute bell has rang, and I need to just get to the management part, and somehow or the other in just 1 minute I just had to rush and do the examination, and then in 1 minute I had to end up doing the management, and of course I did not pass that station, and because of that I had to go through that trauma and get over it so that I can make sure that the rest of the station doesn't get compromised because of it. Okay, so I wasn't mentally prepared for it because nobody told me that okay, this could also happen. So always look for hidden mannequins. Sometimes it's placed under the table as well, but this is something that it's a very luck based thing, and in order to avoid this thing, in order to avoid this error, what I would recommend you guys is to remember the cases. Okay, and remember the cases, or keep an eye for the combined stations in those cases which you think that may come as combined station, or which have been coming as combined station in the past. Like for example, in the previous lecture I did share the example that all the I and ENT cases, they are most likely to be combined stations. Okay, they can be combined. Okay, other than that, the abdominal complaints, some abdominal complaints like alcoholic liver disease, intestinal obstruction, these are the cases which may come as combined station. Patient with back pain, having prostate issues, okay, they can come as combined station. So if you've read the syllabus in detail, and if you've gone through the cases in details, and if you know that a particular type of scenario comes as a combined station, then you would be mentally prepared. Okay, that okay, this is something that can be combined, and I have to make sure that my history is not in a lot of detail and my history is focused. Okay, so that's the way to go about it. All right, now let's move on to a very crucial task and a very crucial type of station, that is the counseling station. Okay, again, counseling stations are a bit complicated to identify. Okay, because there are a lot of things, okay, that may be there. Okay, so in the counseling stations, the symptom may be present. Okay, the patient can have a back pain, patient can have any symptom, patient can have vomiting, patient can have, chest pain, anything. Okay, symptom may or may not be given. Okay, but what you need to pick, what you need to identify in a task to, label it as a counseling station, okay, and take the counseling approach, is number one, a diagnosis may be given. Okay, the diagnosis may be written down in the task. Okay, which indicates that, okay, you don't need to do a history based approach, the diagnosis is already there. Okay, if the diagnosis is not there, then test results leading to a particular diagnosis may be there. Okay, maybe might be a name of a procedure, a surgery, or any medical intervention. Okay, like for example, colonoscopy, endoscopy, biopsy. Okay, you need to look out for these things. Okay, if they're talking about procedures, if they're talking about any invasive procedures, any medical interventions. Okay, it's most likely to be a counseling station. Okay, and sometimes investigations may be mentioned. Okay, or a lifestyle habit, that means that it's a lifestyle counseling or it's a discharge counseling. Okay, so these are the 4 to 5 things that you need to identify: either the diagnosis, test results, procedure, surgery, medical interventions, uh, investigations, lifestyle. Okay, and or they would be very generous enough to, write it down for you that, okay, this is a follow up station, or they may be very generous enough to, tell you that, okay, the patient is getting discharged. Okay, or they may be very generous enough to tell you that, okay, this patient has learning disability. Okay, so automatically, you would get the idea that, okay, this is supposed to be a counseling station. Okay, and I'll just share a few examples with you, and trust me on this, if you just stick to this basics, you would be able to identify any counseling station in the future. Okay, so I'll just give a few examples for your understanding. Yeah, so you can see the test results are there. Okay, it's very clearly mentioned, so you know that you need to take a counseling approach. Okay, again, test results. Okay, this is just leading to a particular diagnosis. Like if you can see the Benz Jones protein, so this is presenting with back pain, and I said that the patient may also have symptoms that are mentioned in the task, but the test results would be there. So you know that this is multiple myeloma. It's already most likely a diagnosed case. So all you need to do is just counsel, explain the test results, and talk about the next steps of the management. Okay, then lifestyle modification counseling, a lifestyle habit, as I mentioned, that it may be, written down, it may be mentioned. Okay, so you need to, make sure that you're counseling the patient on the lifestyle habits. Okay, then they may be generous to tell you that the patient is getting discharged. Okay, so this is discharge counseling, and they can be even more generous to tell you that, okay, you need to counsel on lifestyle modifications. Okay, follow-up sessions are like quite simple, because it's, very clearly written in the task that, okay, the patient is here for a follow-up, so you know that you have to take the follow-up approach. Okay, and again, it's a follow-up station, it's a follow-up approach that you need to take. um, then the counseling sessions, okay, in which you have to, counsel the relative. So the relation would be mentioned, that, okay, you are talking to the relative. So that is the one key that would help you identify. Other than that, how would you identify that this is a counseling session? Okay, investigations are already mentioned. Okay, the diagnosis is already given. Okay, so you see, the investigation is there, the diagnosis is there. Okay, and the relation is mentioned. So even though a symptom, that is the diarrhea, is present in the task, but that doesn't really matter. Okay, that would not lead to a history based station, because other information says that some investigations have been done and chronic cancer have been diagnosed. Okay, and a story of the diagnosis is mentioned over there. Okay, so you automatically know that okay, this cannot be a history based station, and I'm not supposed to uh, explore diarrhea and end up diagnosing it as colonic cancer. It's already diagnosed. Okay, there is a situation at hand that I need to inquire, and then I need to manage it accordingly. That is what the counseling session is all about. Okay, then as I mentioned, a medical intervention or a surgery or a procedure may be mentioned, like patient wanting a vasectomy done. Okay, he wants to ask about the procedure. Okay, so identifying these keywords, okay, this is like very very important, and the 90 seconds that I talked about, you need to use it wisely in this way, like the way that I'm using it over here. Okay, flu vaccine, it's a medical intervention. Okay, so it's like important to have an idea that okay, how will you pick up the counseling station. Okay, just to recall and just to give you an overview before I move on to the ethical scenarios, it's the diagnosis, test results, procedure, surgery, medical intervention, investigations, lifestyle habits, or they are generous enough to write it down for you that this is a follow-up station, or the patient is getting discharged, or patient has learning disability. All right, so I hope that I have cleared it and I've made it clear. So now let's just move on to the ethical scenarios and try to get an understanding of what the ethical scenarios are and how to identify them. Okay, so breaking bad news station. So okay, so this is like a category which is heavily tested in the exam. You will always have one breaking bad news station, and there are around 8 to 10 different cases. Okay, so the best way of identifying it is you should know and you should remember okay what are the cases in which you have to break a bad news. Okay, like for example, this bilateral stroke case is a very very common case, okay, that very frequently shows up in the exam, uh, in which you have to break a bad news. Okay, other than that, breast cancer, atrial bypass. Okay, so you should remember that what are the cases that usually show up in the exam in which you have to break a bad news. All right, there is no specific way, there is no specific key or basics like it was there in the history base and the counseling sessions to identify one particular thing as a ethical session or one particular thing as a breaking bad news session. You should just remember the cases that usually show up in plateau, and if there is a new case, okay, then you should use your gut feeling. Okay, you should use your brain to identify that okay, what kind of news can be a bad news. Okay, like bilateral stroke can be a bad news. Okay, somebody being diagnosed with any type of cancer can be a bad news. Okay, somebody expecting to be pregnant, already knows that they're pregnant and expecting to have a baby, end up knowing that they have a miscarriage, or end up knowing that this pregnancy is unfortunately an ectopic pregnancy. Okay, so that is what a bad news is. Okay, so you should be like very well aware of the medical situations as well. Okay, that because sometimes a completely new case may show up in the exam. All right, then there are abuse stations. Okay, abuse stations, you should be able to identify what abuse stations are. Like for example, spinal fracture, we all know that spinal fracture occurs in non-accidental injury. Okay, and sometimes domestic abuse station people may come to you with some concerns. Okay, they may not be opening up. Okay, they would be giving you some non-verbal clues, not making eye contact, looking here and there, and not being very comfortable in talking to you. Okay, or they might be having some complaints like difficulty in sleeping. Okay, complain of palpitations. Okay, complain of low mood. So those stations can go into the abuse direction, that okay, there may be and some sort of abuse involved in it. Okay, then LGBTQ sessions, this aspect can be tested in any exam, in any session. To be very honest, a patient just may present with chest pain. Okay, and you may just think, okay, this is just a medical diagnostic session, but They may add the LGBTQ aspect to it, okay, by just adding a gender change or a sex change journey of the patient in the scenario, okay. And sometimes you may see two different names in the task, okay, like Peter Smith, also known as Anna Smith, okay. So you automatically know that there is something fishy, okay. If not, then when you begin the session and when you introduce yourself that hello, I am Dr. Siddhyaki, one of the FI2 doctors in this GP surgery. Am I speaking to Peter Smith? And then they would say that okay, no doctor, I'm not Peter Smith. I prefer to get called as Anna Smith. Okay. So sometimes this particular line may not be mentioned. Okay, it may be missing. Okay, it might just say that okay, this is Peter Smith. Okay, Peter Smith presented to you with chest pain. Okay, and when you go inside this session and you introduce yourself and ask, okay, am I talking to Peter Smith? And they're going to say, no, doctor, I'm not Peter Smith. I used to be called Peter Smith, but now I prefer to be called as Anna Smith. So you'll have an idea at the very beginning of the session that okay, um, this person has changed their name, and there may be a sex change or LGBTQ aspect involved to it. Okay, so you need to make sure that you identify a sex change or LGBTQ aspect as early as possible, so that you can ask about that particular aspect, and you can explore the sex change and how their mental health has been, and the psychosocial aspect of the LGBTQ scenarios. Okay, then there is a category of the problem colleague. Okay, very simply, it would be written to you that FI1 in your unit. Okay, so it automatically tells you that okay, this is a colleague of yours. Okay, and then there would be a problem that would be mentioned that okay, he smelled alcohol. So you automatically would know that okay, this is a problem colleague session, and I need to talk to my colleague and discuss his concerns, and make sure I monitor and manage the situation at hand. Okay, then there might be a few cases in which you have to deal with a medical error. Okay, and it would be very clearly written that the biopsy was not found, like for example. So, okay, so it would be written that okay, an error is made, a biopsy is not found, the blood sample was lost, or maybe one of your colleagues misdiagnosed a fracture or misdiagnosed an MI and sent the patient home. So the error would be very clearly written. So you would know that okay, this is a medical error station, and I have to take the medical error management approach. Okay, then angry patient. Okay, angry patient was something that really but like it gets really difficult to manage. Okay, and sometimes the GMC is very generous, and they very clearly mention it outside that the mom is angry, or the patient is angry, or XYZ person is very angry at you. So you know that you have to take the angry patient approach. But sometimes it's just a random task that is mentioned, just a random scenario that is mentioned, and it's not clearly given outside the cubicle that okay, the patient may be angry. But then as soon as you step inside, and as soon as you begin with the station, the patient is going to come at your face, and they'll be like, "Okay, what are you doing? I did not expect this, and you shouldn't have done this. You were about to kill my child," and blah blah blah. And then they'll start shouting at you. Okay, and then at the very beginning of the station, even before you start talking, even before you end up introducing yourself, even before you start doing the rapport building, you would realize that okay, this is an angry patient, and I need to just forget everything and just first manage the anger of the patient over here. Okay, so two ways to identify it: either GMC is generous or they're not generous. Okay, so yeah, that's how you're going to identify a few ethical scenarios, and I just gave you the examples of it. Then we have got the cement station. Okay, the cement station would be pretty easy to identify because there is one room in the corner that is dedicated for the cement, and when you just peek inside, you would see that there is a cement that is lying there. But let's suppose if the door is closed, if there is curtains, then you would see this line: setup talking mannequin. Okay, this particular line is like very important, that will help you identify that okay, this particular type of session is a Simmons station, okay, and then you would have to take the Simmons station approach. All right. Then, as I mentioned earlier, that there are a few teaching stations that would come. It would clearly, mention that teach him, teach your colleague, teach your junior, teach your student a particular thing, okay, a particular topic. Very straightforward, no rocket science involved. Prescription stations, it would give you the task that okay, you need to write down the prescription of a palliative care medication, or write down the prescription of a disease or anything, and then they would be giving you certain drugs. They may give you certain drugs that is written, and they would see that how you are writing it down in the prescription, or they may not. Okay, it depends on case to case, but prescription station would be particularly easy to identify. It would be clearly written that this is a prescription station and you have to write a prescription. Okay, so this is how you're going to identify. Okay, not in most of the cases, but most likely you're going to see these things somehow or the other in the task. But now, as I mentioned, and this is the very very important part and the last part of today's lecture, that GMC is not being so generous nowadays. Okay, GMC is trying to give you a hard time, to be very honest. And what are they doing is that now, because they know this trick that okay, the students are able to identify what type of station it is, they are giving you the mystery station. Okay, I call it the mystery station. Okay, now why I call it the mystery station is because in the task outside, they just write one thing, Aaron Smith age, and they just write that they are here with some concerns. Okay, and that concern can be anything. Okay, that concern may be a symptom. Okay, that concern may be a diagnosis. That concern may be asking about a particular procedure, asking about a particular medical intervention, a concern about an investigation. Okay, or it can be some ethical scenarios as well. Their concern may be that they got a biopsy done and then they just got to know that somebody has lost it. Okay, so this type of session can lead to anything. Okay, it can lead to literally anything. Okay, it can be history based, it can be combined sessions, it can be counseling sessions, it can be ethical scenarios. Okay, and like these are the categories that some concerns may end up. Okay, it's unlikely to be a teaching session, it's unlikely to be a sermon, it's unlikely to be a prescription session. Okay, if the task says that the patient is here with some concerns. Okay, so what to do in these type of stations? Okay, in these type of stations where you don't get the idea, where your 90 seconds would not be used to prepare the structure, you recall the structure, and list down the important questions and the scenarios that you need to assess and you need to discuss. What you're going to do in these type of station is that number one, you need to calm down. Okay, and the first thing that you need to see is that where you currently are. Okay, you need to see the setting. Okay, and you just need to read the task, that talk to the patient, address the concern, and manage it. That is all you can do. And the moment you enter inside, okay, and after you begin your station, okay, and after you have done the rapport building, after you have introduced yourself, okay, you need to ask and you need to begin your station like this, that hello Mr. Aaron, I can see from my notes that you were here with some concerns. Can you please tell me more about it? Okay, and when you say can you please tell me more about it, okay, that is where you will get the information, that is where the patient will tell you what to do. That is where the patient will either give you a symptom, okay, or the patient may give you uh, a diagnosis, okay, or hand over you the test results, or give you some procedure that he wants to know about, a particular surgery that the patient may want to get. Okay, or maybe he or she may throw a concern at you that okay, I need to ask about a lifestyle habit. Okay, so all of these things, okay, in that 1 minute you'll get those things. Okay, and if you get a symptom only, you know that this is a history based station. Okay, and if you get uh, a diagnosis or a test results, or if the patient asks about the procedure, you know that this is a counseling based station. Okay, and something from the ethical category may also come, and it can be like anything. They can, talk about that they got a biopsy done, and they got to know that it's lost. Okay, or they may just show some anger at you. Okay, that okay, why have you done this, why have you done that? Okay, so in those that 1 minute you would have to identify and understand that okay, what type of approach you need to have for this particular type of station. Okay, and that is where this mystery station gets a bit tricky. Okay, so I hope that I have covered everything in detail, and you must have developed a better understanding of how to use those 90 seconds. Okay, and in the next lecture it will be a short one in which I'll tell you what is the ideal time division you should have for every type of station, so that you know that okay, how much detail you should ask, and how to take a focus history, and how to make sure that you're doing the right thing at the right time. Okay, so that's pretty much it. If you've got any questions and any queries regarding this particular section that I covered today, drop down your queries in the comment, or reach out to the social media, or to the contact details that are mentioned in the footer of this screen, and I'll be happy to address all your concerns. Thank you.